the world. It's often stated, people ask, does healthcare stink in America? Well, they don't like it. Would you leave America to get healthcare elsewhere? Nobody leaves. We have the best healthcare if you can get to it. We don't want rural America left behind anymore. As an aside, by the way, we've talked about the most favored nation drug pricing. One of the first companies and areas we used most favored nation drug pricing is fertility drugs. That's why we're going to have so many Trump babies, because we've dropped dramatically the most expensive part of the fertility space. And so America no longer will pay so many times more, in that case it was 10 times more, for the same fertility drugs that they're available for moms who want to get pregnant in Europe. I want to thank Terry, who's here as a nurse practitioner, Andrew, who's a doctor, West Virginia, New Mexico. They're representatives of the workforce in rural America. But there are only two of them here representative because we don't have enough people working in rural America. It's a big challenge. So Delaware is creating its own medical school, their first ever medical school in a rural part of the state. So that can get more local talent that will stay local in those parts of Delaware. Michigan is launching the high school to healthcare pipeline grant program. They want to take kids out of high school in Michigan, local rural communities, and get them into the system, get them trained as nurses, because they'll stay home because they're from those communities, and they'll save lives for decades there. These are the types of programs that can get our rural communities and economies up to high gear and keep it that way long after this 5-year funding is done. And finally, tech innovation. Rural communities would benefit the most from high-tech advances, like we just discussed, as possibly if there was a head trauma case. Many states want to partner with our CMS data interoperability network. It was created by Amy Gleason, who spearheaded so much of the technology transformation in our government. It's going to support the President's pledge to provide transparency that he mentioned as part of the great health care plan. And Congress can ensure these are all available for decades to come if we can get this legislation through. As in the tech innovation forefront, just to give you a couple examples, Texas and Hawaii are making targeted investments in statewide telehealth, so everybody has telehealth. The best doctors for the best knowledge available where you are. We'll meet you where you are. If you're a vet and depressed and you're thinking of taking your life, we'll be there. Just let us know you're in trouble and we'll help. Alaska wants to deploy, and I'm going to hand it to Senator Sullivan in a second, wants to deploy unmanned pharmaceutical distribution kiosks and drones that will deliver medications, because in the North Slope of Alaska, you can't get there this time of year. So these technologies, they exist. Why are we using them in Midtown Manhattan? We should use them in rural Alaska. This administration is committed to collaborating with all 50 states, all 50, red and blue, all 50 states, to carry out bold plans to tackle the challenges that local communities face. We're not pouring funds blindly, however, into a broken system. We're going to carefully, precisely, as the President said, target this investment. With healthcare front running rampant, and I was in Minnesota this week, Mr. President, it's worse than we've heard, but Minnesota, pardon the pun, is just the tip of the iceberg. California is the varsity team when it comes to fraud, waste, and abuse. We're not going to let that happen. We want transparency for this $50 billion investment. We owe it to Capitol Hill, we owe it to this President, and we want accountability to be a top priority. For that reason, we've created an Office of Rural Health Transformation at CMS for long-term oversight. The office, led by Alina Check-Guide. Alina, again, was one of the people who helped create this program in the forefront, will guide, she was in the first administration, Mr. President. She's going to guide states in implementing their rural health transformation plans, coordinate all the federal and state partnerships, making sure there's appropriate oversight. In addition, every single state is going to have a dedicated project officer. We will be there with you. We're going to help you. Please engage us. You've got lots of lives at risk. It's a true state-federal partnership, unbelievable, extraordinary milestone for healthcare. Your zip code will no longer dictate whether you have excellent healthcare. Your zip code will no longer be your destiny. It's not going to dictate your life expectancy. Mr. President, I cannot thank you enough for the leadership that it took to get this $50 billion investment in rural healthcare. They don't make a lot of noise. They just want to get the job done. You stood up for them in Congress. God bless you for making this possible. Please do it again. Please do it again for the great healthcare plan. Let me hand it to